Welcome to our comprehensive guide on sexually transmitted diseases, or STDs. Today, we'll be breaking down the most common types and how they can affect your health. We'll talk about the symptoms, the causes, and the treatments available. And remember, knowledge is power. The more you know about STDs, the better equipped you are to protect yourself and your partners. This isn't just about memorizing facts, it's about understanding the importance of sexual health. So let's dive in and break down the stigma surrounding STDs. Let's start with bacterial STDs, some of the most common infections we see. These include chlamydia, gonorrhea, syphilis, and chancroid. The good news is, they're often curable with antibiotics. Chlamydia and gonorrhea often have similar symptoms. Think painful urination or unusual discharge. But here's the catch. Many people don't experience any symptoms at all, especially early on. That's why regular testing is crucial. Syphilis, on the other hand, can have different stages, each with unique symptoms. It might start with a painless sore, but if left untreated, it can lead to serious complications affecting the heart, brain, and nervous system. Then we have chancroid, less common but still important to know about. It often presents as painful sores in the genital area. The key takeaway here? Whether you have symptoms or not, regular testing is essential for early detection and treatment. Now, let's talk about viral STDs. These are caused by viruses and can have a wide range of effects on the body. Some of the most well-known viral STDs include HIV, HPV, herpes, HSV, and hepatitis B and C. HIV attacks the immune system, making it harder for the body to fight off infections. It's important to remember that with modern medicine, HIV is manageable with proper treatment and care. HPV is incredibly common, and most people will have it at some point in their lives. While many strains have minimal impact, some can lead to genital warts or even increase the risk of certain cancers. That's why HPV vaccination is so important. Herpes, specifically HSV1 and HSV2, is another common viral STD. It causes painful blisters and sores, and while there's no cure, antiviral medications can help manage outbreaks and reduce transmission. Hepatitis B and C primarily affect the liver. While they can be transmitted sexually, they can also spread through contact with infected blood. Remember, if you're ever unsure, it's always best to get tested and talk to your doctor. Moving on to parasitic STDs, these are a little different. They're caused by tiny parasites that can live on or in the body. Common parasitic STDs include trichomoniasis, pubic lice, also known as crabs, and scabies. Trichomoniasis is caused by a parasite called Trichomonas vaginalis and is one of the most common curable STDs. Most people with trich don't have any symptoms, but it can cause itching, burning, and discharge. Pubic lice are tiny insects that live in pubic hair and feed on blood. They can cause intense itching, and while uncomfortable, they're usually treatable with medicated creams and shampoos. Scabies is a skin infestation caused by tiny mites that burrow into the skin to lay eggs. It can be spread through close physical contact, including sexual contact. Like pubic lice, it causes intense itching and is treated with special creams or lotions. The important thing to remember is that parasitic STDs, while uncomfortable, are highly treatable. Don't hesitate to see a healthcare professional if you suspect you might have contracted one. Now let's talk about a fungal STD you might have heard of, candidiasis, or a yeast infection. Candidiasis is caused by an overgrowth of a type of fungus called candida, which naturally lives in our bodies. While it's not always sexually transmitted, sexual contact can be a factor. It can cause itching, burning, and a thick, white discharge. The good news is, it's usually easily treated with antifungal medications, available in creams, ointments, or oral medications. For those with weakened immune systems, such as those with HIV, managing candidiasis might require extra attention and care. Finally, let's touch on a couple of less common STDs. Mycoplasma genitalium and lymphogranuloma venereum, often referred to as LGV. Mycoplasma genitalium, often called M. genitalium or MG, is a bacterial infection that can cause urethritis in men and cervicitis in women. It's often asymptomatic, but can lead to complications if left untreated. LGV is another bacterial infection, but it's less common in many parts of the world. It often presents with flu-like symptoms and swollen lymph nodes in the groin, and if left untreated, can cause long-term complications. These less common STDs highlight the importance of regular testing and open communication with your healthcare provider. Remember, prevention is key. Practice safe sex, get regular checkups, and communicate openly with your partners. If you suspect you have an STD, seek medical attention promptly. Knowing your status is crucial for protecting yourself and your partners. Don't let fear or stigma prevent you from getting tested or seeking treatment. Stay informed and stay healthy.